This is Raquel.
No.
Gabriela.
No.
No, what? 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 No, don't touch that. Gabriela. Gabriela. Raquel. Said hi. Hi. Hello guys, welcome to Curly Fitness 1980 and welcome to another video. So this little clip you just watched was the girls, and they are the reason why my body's going through all these craziness that's going on with my body. So they're gonna be two. I can't believe it. Time flies. Time flies. So but anyway, today, based on the title, you already know what we're gonna be talking about. And if this is your first time watching this video, thank you so much for watching, and don't forget to subscribe, join the family, and also don't forget to hit the notification box because I have video every single week. I don't really have a set days, which I'm working on that because you know I'm always busy with the twins and I'm back to work again, so my schedule is like crazy, so I don't really have a specific days of the week, but I always try to get one video every single week. So please subscribe, join the family, and also share this video, and yeah, let's support this channel. Okay, so based on the title, guys, you already know what I'm gonna be talking about, and I did have a video talking about my second surgery that I had to do because of the capsular contracture. So if you are new to this channel, you're probably not gonna know exactly what I've been through. So long story short, I had a mommy makeover going on 10 months, and after I did the mommy makeover, but before that, after giving birth to the twins, this breast here was capsulated. I fixed it with the mommy makeover. Then the capsular contracture happened again. I went back again and fixed it back in November, and it happened again. So that brings me now to this video. I did have an update about a month or so ago. I will put the link down below up here, or I have a mommy makeover playlist too. You guys can watch all that as well. So now I started noticing the breast started to get tightened again after I did my second surgery to fix the capsule in November. So the second week, everything was okay. The third week, I started feeling like that tightening starting to happen again. I went to see my doctor. He says that, you know, just keep doing heavy massage. We literally like manipulate the implant. I did just that, and it just keep on tightening again. So I've decided to you know, do some research about the Aspen Therapy. So I went to see my doctor a month later. He suggested for me to try it also. So I've done the Aspen Therapy, and I'm done with all the treatment. So I did 10 treatment with them, but I'm still under kind of like their watch a little bit, because what I'm doing now, I have to wear this for like almost like 22 hours a day. The only time I take this off is when I'm going to take a shower and everything. That's the only time I take it off, and I put it right back on. So which makes going out a little bit very difficult for me because I'm constantly wearing this thing, but I have to. I will be showing you guys how it looks in a second. So the Aspen Therapy, pretty much what that is, it's like a machine. It has like two big cups. So the cup kind of like this, and then inside the cup it has a gel on it, kind of like a silicone gel, and then they place it like this on the top of the breast like that for 6 minutes, and then they place one cup on the breast for like another 6 minutes, and after that they go and they massage the breast. They really like focus on mobilization, they call it, where they kind of like press like this really hard on the breast. They press this way, they press that way, and they press up. Really like the whole treatment is like 1 hour every time I go there. So, and I did 10 treatment once a week. So I pretty much did it for like almost a month and a few weeks. So that helps. It dropped the breast because the breast was like up here. So it dropped the breast. But then after I was done with the treatment, I still noticing like the breast was starting to get hard again. I mean, the breast come down, but it was still hard. And I was like, I'm like, cannot keep happening. But long story short, I've decided to do some blood work because I'm very big on making sure I check everything in my body. Like I do my annual pap smear every year, my blood work every year, which is very important. So I've decided to go ahead because it was time anyway to do my blood work, which I go to a place called East and West Physician right there in Coral Springs, Florida. Great place. I love it there. So it's an anti-aging. They specialize in natural medicine. They have chiropractor. They do everything. Everything you can imagine, they have it under one roof, from Botox, everything. So one of the doctors that I went to see, that was Dr. Newman, and he did my blood work. They called me a week later to go and see to go over my blood result. So long story short, and this is somebody that really, this is my first time going to that place, you know, going there. And then he says to me, are you breastfeeding right now? I was like, no. He says, well, if you're not breastfeeding, you have milk. I was like, what do you mean I have milk? He's like, yeah, it shows that you have milk. And I'm like, that's impossible. I haven't breastfed for almost 18, 19 months because I was only able to breastfeed the girls for maybe 1 month. Then I realized that I have the capsule, so I had to stop breastfeeding because I wasn't sure what was going on and I didn't want to get them sick. So I haven't done any breastfeeding for almost 18, 19 months. So when he said that, I was shocked. And I'm like, can I ask you a question? He says, yeah. I'm like, please tell me this could have something to do with what I'm going through. And then he says, what's going on? And I explained to him the surgery and everything. He said, I'm pretty sure that could have something to do with it. And I asked him, do you see that happen a lot? It says sometimes the body can still produce even after you go under, you know, surgery to do your breast and everything. And which is very surprising because I've done everything before the surgery. I even waited longer than I'm supposed to because some, you know, the rule of thumb is you're supposed to wait, I think, 7 or 8 month post after you breastfeeding, after you're done breastfeeding to go under this, to do any kind of surgery. I waited like 13 months because I did my surgery back in May. So the girls was, yeah, I did the surgery in May. So the girls was 13 months when I did in the surgery. So I didn't have any milk supply whatsoever. At least that's what I thought. But I did all my blood work. Everything was okay. So my doctor said that it's possible that that could happen literally right after I got my breast done, or something can trigger in my body because apparently once you give birth, it takes anywhere from 24 months, sometime even longer, for your body to actually just, you know, said, okay, I'm done with this pregnancy, because technically my body still thinks that I'm pregnant. That's pretty much what he explained to me. And I'm like, are you kidding me? So now not only I'm dealing with this capsule and now I have milk, and I'm like, okay, well, when I got home, I said to myself, if the doctor said I have milk in my breast, I need to see where the hell that milk is coming. So I was like just playing with my breast, like really massaging it really hard and everything. Sure enough, I'm like literally, I pop, and then I heard a pop, and I'm like, and then milk was coming out. Not like a lot of milk, but just like milk was coming out. I'm like, oh my gosh. So obviously there's nothing my plastic surgery can do at this point on. It has nothing to do with him. It's just my body. So what I'm doing right now, I call my OBGYN and I explain to him what's going on. He says that he needs to do a blood work. I told him I've already done that. So he wants me to bring all the paperwork so that way he can go see exactly what's going on. I don't know if they're going to give me some kind of like prescription. But meanwhile, I'm already doing sage tea, which help with drying the milk. I ordered a special tea that my friend was telling me about that could help. I'm taking vitamin B6, which help with drying the milk out. I'm doing a bunch of things until I go see the doctor, because the earliest that he can take me, it's on the 13th, to see what's going on. Now, if everything else fails right now, as of right now, I have to figure out what's going on. So now, as much as I'm upset, but at least I know what's going on, is something that I really need to get it taken care of. Now, after I've done all this, if the breast still acting up, I'm gonna wait a year, because the doctor said that it takes anywhere from a year to give my body a break, just so that way after I go see the doctor for the milk to see what they can do for me, whatever the case may be. Once I get that situated, I still need to give my body a good year to see what it's doing. So if it's still doing that, then at that point on, I will just take everything out. As much as I love my breast, but it just one thing after another with this breast, and I can't keep going. I can't keep living my life like this. I'm doing this video only because some of you ladies might be thinking about getting your breast done, and if you are pregnant, or you know, if you new mom out there, just wait. I mean, I did wait 13 months, like I said. You can't, you know, but your body apparently is gonna act certain ways, and in my case, the doctor said it's 1 out of like 50, 60 women, and again, I'm one of them, and I gotta tell you, like, this pregnancy really did a damage to my body. I will definitely keep you guys posted, and I wanted to let you guys know what's going on. But I'm gonna go ahead and show you guys how the breast looks. So this is a breast that's pretty much normal. You can see it's soft, and then this is the one that I have to wear, but I'm gonna remove this, and I'll be right back to show you guys how it looks when I don't have the band-aid on there. Okay, so I'm back. So this is how my breast looks. This is the one that you can see. It's like really hard, but yep, this is it. But yeah, so it is what it is. This is the reality of it. There's nothing I can do at this point on. It just, I have to keep it positive and hoping that I can, you know, beat this. But yeah, I wanted to show you guys what's going on. And please, I'm telling you guys, in the video, my breast looks a lot bigger, and for some reason than it is in person. I am not that big, but for some reason, every time I do this video, I'm showing you guys, it shows like it's so big, but I don't know why. I really don't. But anyways, so yeah, this is how you can see it's, oh, yeah, story of my life. But anyways, guys, I wanted to do this video to kind of like let you guys know what's going on with this boobs situation. If you guys have any question and any advice, please leave them down in the comment below. And one thing, please, I had to block a few one person already, because when I do this video, I don't do it for attention or anything like that, or for anybody pleasure. I do this as an educational purpose, because I know what I'm going through after giving birth to the twins, and you know. But if you guys have any question, any advice for me, please definitely leave them down in the comment below, and I will definitely you know, respond, or whatever you think, or whatever you advice you have for me. But I'm definitely gonna go see my doctor, my OBGYN, on the 13th. Once I go see him, I will definitely follow up with you guys. So on that note, I have to keep it positive, and I'll let you guys know, and I will definitely see you guys next week on my next video. So as always, guys, be you, be fit, be blessed. Have a wonderful day, and I'll see you guys in my next video. Bye.